You're live on YouTube.
काय जे 3 मास्क दिलेत ते याचं यांनी डोनेशन मध्ये मिळालं आम्हाला. ते डोनेशन मध्ये मिळालं.
Live on YouTube.
ते बाहेर मिळतात 200-400 रुपयाला डोनेशन ना फुकट. हेलो, हाँ जूही, आवाज सुनाई दे रहा है क्या तुझे? आवाज सुनाई दे रहा है? हेलो हेलो हेलो.
Is there someone speaking who is not in the queue?
Dr. Shuday, he is having cesarean.
Okay. Okay, he is on a call or something.
He is on a call. He will join 6:30.
Yes, yes. Cool.
नाही दोन.
Go ahead.
As for me and my house,
Yes,
Good,
Dr.
good evening. Good evening, everyone. Namaste. I'm sure that our prayers has reached the Almighty and He will bless us this webinar. I, Dr. Francis Vaidya, on behalf of the management, principal, staff, teaching and non-teaching, and my dear students, along with the team of Holistic Center and the distinguished panelists, I welcome you, dear participants, for this live webinar on coexisting with COVID-19. The Holistic Center had already organized a webinar on stress management, and the overwhelming response and innumerable queries by you, my dear participant, is what made us decide to host another webinar to help us to answer your queries related to COVID-19. Of course, this webinar is in collaboration with Gandhi Section Bhavan, Srimati Surajba College of Education and Holistic Center. I now call upon my principal, Dr. Ratnaprabha Rajmane, to tell us about our institution. Over to you, Dr. Ratnaprabha Rajmane.
Thank you, Francis. Thank you, Francis, madam. Good evening, one and all. It is my pleasure to introduce my institution and about my college. I'm very happy today because we wanted to do this webinar and it has come in true and it has not become a dream only. My institution, Indian Council of Basic Education, is established in 1964. A group of teachers, they have come together last 54 years back. Vajubai, Shri Vajubai Patel, Shri Shesh Tamble sir, Acharya Bhise, Srimati Sulabha Panandikar, and they have gathered together and they have established Indian Council of Basic Education in 1964, 63-64 under the Bombay Trust Act 50. Our founder, Shri Vajbhai Patel and Srimati Leelaben Patel has given vast contribution to the institution. Our present president, Srimati Nupur Mitra, our honorary secretary, Asha Damle, and all our management members, they are the prime motivator for doing all these things. And they are always seeing that the progress of the institution should be there. Here, our Srimati Sureshka College of Education, established in 1969, Gandhi centenary year. We have just completed our 50 years golden jubilee, and we are going ahead for the 51 year now. Our institution is a teacher education institution, basically the teachers training college. And that is what our vision is, provide the quality education for empowerment and enlightenment through Gandhian philosophy and prepare a socially committed teacher. Our teachers are the special teacher and recognized in the society as a special teacher also. That is what the socially committed teacher we want. That was our vision. Our mission was, it is a dissemination and nurturance of the Gandhian values to develop and involve innovative, dynamic teacher for the welfare of the society. Always our management is Gandhian management and they are thinking for the welfare of the society. Our goal is to make the teaching enjoyable, to create a teacher with a well-integrated personality. Teacher as a social agent, to develop the research skill amongst the teacher. From the beginning, you will not believe, our founder was so visionary. He has our own magazine, Best in Education. That is a research magazine. Small research we were doing, going to the slum areas and all. And that magazine is still it is running. And I'm an editor of that Best in Education magazine. We got lots of achievement also. First, National Accreditation and Assessment Cycle, NAC. We got A plus in 2003 and 4. Second cycle, accreditation, we got the B and 2.85 in 2011. Third cycle, we have done the hike and we got A plus 3.54 in 2016-17. There are some unique features of our institution also. Our college is offering the Mumbai University syllabus, but intrinsically it is woven with the Gandhian philosophy and Tagore's philosophy. Every day Sarvadharma Prarthana we are doing. Paper reading basically on the social issues. That is one platform we have given to the students. Come ahead and talk about the social issues and be aware make aware to the society and yourself also. Celebrating all national seasonal festival we are celebrating. We are promoting the handloom also, and collaboration with the different NGOs are there. Our major trust is the ICT. Though Gandhian institution is there, but we have to go ahead with the globe. That is what the ICT trust is also there. And always we are interweaving the Gandhian philosophy with the Mumbai University syllabus. We are doing under the Mumbai University. Our college is running affiliated to Mumbai University, but always we are thinking that the basic philosophy should be there. And I hope this webinar is a basic philosophy of our Gandhi Shikshan Sureshka College of Education conducted by Indian Council of Basic Education. And we all will go together. All the best for this webinar and doctor's webinar. That is what we are looking forward that it will be very useful for us. I thank to Dr. Saurabh that you have arranged all these things and you are taking us ahead. I thank to all panelists also. They are with us. Dr. Shivdev will also join because of his medical emergency. He will join with us.
Thank you, Dr. Ratnapabha Rajmani. And now I invite Dr. Saurabh Talikar, Director Founder of Holistic Center, to talk about his organization. Over to you, Doctor.
Thank you, Dr. Francis. Hello and welcome. My name is Dr. Saurabh Talikar. I'm an orthopedic surgeon. I specialize in knee and hip replacement surgeries. I'm also the founder and director of the organization called Holistic Care Center. Holistic Care Center is located in Vidyavihar, Mumbai. We mainly focus on holistic medicine. What is holistic medicine? It is to realize that a human being is not mere body, flesh, bones, and skin. We understand that a human being is made up of body, mind, and spirit. Hence, we use our modern medical approach with multiple trained specialists in multiple allopathic medical fields, combining it with harmony of the old methods, ancient methodics of yoga and meditation. Today, we have here a panel of very interesting members, gynecologists, metabolic geriatric specialist, Yogi Sakha, my partner who takes care of the yoga and mind healing part. Since the lockdown, the Holistic Care Center has not been shut down. We have been trying to help the society as much as we can. We've started and continued our process through online video consultations. We also provide sports activities, meditation sessions online. We are also helping doctors to get back to their practice. I have taken personally courses from the WHO regarding the preparedness for the COVID-19 situation. In this pandemic, the safety of the doctors and the staff who are saving all the lives is very important. So I've taken this up and I'm trying to help out doctors from small clinics to restart their practice. And that is why I am here to you. And today's topic will be a little bit about the safety while going out when we are done with the lockdown, when the lockdown opens, how we would practice safety and how do we get back coexisting with COVID. Thank you very much, Francis ma'am.
Thank you.
Thank you, Dr. Saurabh. Since you have already oriented us with the topic coexisting with COVID-19, I take this opportunity of introducing all the eminent doctors on the panel. The first I would like to introduce is Dr. Ketan Parkley. Sorry, doctor. Pediatric physician specialist in metabolic syndrome. He's the founder, Metabolic Syndrome Clinic. He's also an assistant professor, D.Y. Patil University, Navi Mumbai. His fellowship in obesity, diabetes, endocrinology, Luton and Dunstable University, London, United Kingdom. He's awarded as Innovative Researcher in Health Science for a Metabolic Syndrome Clinic by World Research Council and United Medical Council. The next I would like to introduce is Yogi Sakha, the holistic health and happiness coach, certified nutritional consultant, NHI California 2017. He's an MBA holistic management and has over 17 years experience in holistic wellness of body, mind, and spirit. We also have Dr. Ravindra Shivde. At the moment, he's in emergency to deliver a cesarean patient. But however, I would like to introduce him He's an obstetrician and gynecologist from Nasik, MD. He's a DGO from SATE GS Medical College, Mumbai, and is running his maternity and surgical nursing home in Nasik for last 38 years. He is the past president of current trustee of Nasik Obstetric and Gynecologic Society. His Sujan conference on genetics and fetal medicines organized under his chairmanship was a grand success. He was honored with Dr. Gupte Memorial Award for model medical service to people of Nasik in 2007. He was honored Nasik Indian Medical Association Ideal Doctor Award in 2011. He was honored with Obstetric and Gynecological Society Lifetime Achievement Award in 2015 and with Lions Devdut Award in 2018. The last but not the least on my list is to introduce Dr. Saurabh Talekar, the director founder of Holistic Center. He's a musculoskeletal orthopedic surgeon, MD specialist in orthopedic surgery, D Ortho, College of Physicians, Mumbai with association with DL Hiranandani Hospital. Fellowship in Basic Knee Surgery, Moscow, Smith and Nephew. Fellowship in Advanced Knee and Hip Surgery, Sitcot, Belgium. Welcome to all the panelists on this webinar on COVID with coexisting COVID-19. Now that we have introduced all the panelists, my first question goes out to Dr. Ketan. Dr. Ketan, can you highlight on what is metabolic syndrome and how is it significant to metabolic syndrome with COVID-19?
Yeah, hello everyone. Thank you so much for introducing me. I'm Dr. Ketan. And first of all, before going further, as I just got to know from Ratnaprabha Madam, I would congratulate you all and your team on completion of 50 years of your institute, and I wish good luck for your coming years and starting with 51. Coming to back to the question, what Madam has asked about metabolic syndrome. Let me just put a focus on metabolic syndrome, what exactly it is. We all know we are living with a pandemic COVID-19 now. A similar parallel pandemic is going on in the world, which is non-infectious, which is called as metabolic syndrome, which includes your diabetes, it includes your hypertension, it includes your lipid profiles, that is HDL, cholesterol, triglycerides, and your obesity part. So I've mentioned 5 things here: diabetes, obesity, hypertension, your lipids, that is HDL, and triglyceride cholesterols. So when these 5 things are present in a person, that are also one of the scenarios which we get. But when 3 things are present out of all these 5 things, we label the patient as metabolic syndrome. And when this metabolic syndrome is labeled to any of the person or any of the patient, then the consistency, the life quality of the life of a person goes down, and they are more prone to get heart attacks and cardiac diseases. And this is called as metabolic syndrome and the significant part of metabolic syndrome. And the significance, if we are talking about this during this COVID-19, is definitely there is a strong correlation between this. Historically, if we see, the viral flu has not been kind to the people, and especially for those people who are already having metabolic syndrome. And diabetes was one of the major risk of this increased morbidity and mortality in the patient with even H1N1 influenza. And a pandemic of SARS, what we got is severe acute respiratory syndrome. And so the outcome of these patients are complicated. Now, if we see, Asia is less affected than the European countries and US, because we don't have that BMI or the over obese people in India. though we stand second in the world, but the pandemic of this obesity and metabolic syndrome over there is bigger. And that's why the outcome of these patients in this patient of this patient from this COVID-19 is tricky situation, and the complications are majorly seen in these people. So in short, it is people with metabolic syndrome take longer to recover. So that is why the significance of metabolic syndrome with COVID-19 is very strongly connected here.
Thank you, doctor. Now that you have told us about the connection with metabolic syndrome and metabolic syndrome of COVID-19, can you elaborate in detail about the lifestyle disease like hypertension, diabetes, and obesity in detail? And could you give us some suggestion to such patients during COVID-19 pandemic?
Yeah, sure, madam. See, the thing, what question actually you asked about lifestyle diseases. I like the word lifestyle diseases like hypertension and diabetes. Actually, it is a lifestyle diseases. It is not given to us by anyone, but we are the one responsible for it. So as of now, today, if we see, ensuring good blood glucose levels, good blood pressure level is a primary important thing, especially in this COVID-19 infection. However, how we achieve this goal is of lesser importance. Okay, if I have to talk about hypertension and obesity and diabetes, I'll come by like a single disease of it. See, imagine, I just want to put a light on this. If we are talking hypertension itself is a disease, if we talk about diabetes itself is a disease, and same with the obesity, it is also going to be labeled as a chronic disease. When these things comes into a one roof, one umbrella, it is metabolic syndrome. How dangerous it is, yeah. So lifestyle diseases like hypertension, if we have to focus now, see, scenario is like current scenario of lot many things which are coming up, like patients who are already on ARBs and ACE inhibitors. These are the group of drugs which patients are not supposed to be taken, which is in the media and newspapers everywhere, yeah. But according to associations of heart associations and European Society of Cardiology, they have not recommended this as because there is lack of concrete data here. We don't have a different pharmacotherapy for these patients apart from ACE and ARBs, and sudden stoppage of these drugs can give to hypertensive crisis. So currently we are continuing these medicines also in these patients of hypertension. Talking now, so suggestion here about hypertension I would like to give is like you continue with your medications. Do not stop it unless and until your physician asks to do. Though if it is you are on drugs of olmesartan, telmisartan, bisoprolol, which are supposed to be dangerous for the COVID-19, but we don't have that concrete data to prove that it has been wrong. As your my first sentence which I said, ensuring good control of your blood pressure is the most important factor now in the COVID-19. So it doesn't matter with what drugs it has been controlled. So if it is controllable on these medications, please continue that. And of course you need to have a reduced amount of salt intake because of scientific reasons behind that. Potassium sparing things are there, so sodium intake should be low. So in this all scenarios, I don't have to go in detail as we have less time, but of course sodium salt intake should be at an adequate amount, so hypertension can be often can be of good control. Talking about blood glucose sugars, we all know diabetes is again a big problem nowadays. Every second person or the second house we have young diabetes also. So I don't want to again go in detail, but I will just suggest few things here for the diabetes. Is about the during this COVID-19 is the diabetic patient should follow sick day rule for them. And what is sick day rule is about hydrating yourself, number one. Second is temperature charting for you, monitoring of your temperature. Third is monitoring of your blood sugar levels, which is again important. And fourth part is if you are already on insulin, then you have to check not only your sugar levels but even your ketone bodies here, because that also is a major junk where patient can land up into the complication of diabetic ketoacidosis. So these few suggestions I would like to give for the diabetic patients here. Obesity is a bigger junk here, which plays a very important role. Starting here, I can just say, I just went through one of the paper which said that article which said that Italy suggested that 99% of their death has been in the patients with pre-conditions, pre-existing condition, including commonest was the obesity, and comorbidity related to it was the hypertension, diabetes, cancers, and the heart diseases as well. So here obesity is also an very important junk which plays an important role, because people are more overweight, they have a demand of more oxygen. See, what is the scenario here? Just going into a brief of it, half a minute I would just take is like, what is obesity? Obesity is excess of, it's an inflammation first of all, and excess of fat cells in your body. We have this much of space, your fat cell is of this size. When you put on the weight, the fat size goes on increasing, so it occupies that space here. So less space and more fat, indirectly what happens, it requires more of oxygen, oxygen demands increases. And what happening is into COVID-19, the patients are already getting hypoxic, they are going on ventilators because their oxygen requirement is more and they cannot compensate. And in this scenario, when the patient who is already obese, he is already demanding for more of oxygen, is already partially hypoxic, and when he gets prone to COVID, then already the demand is so huge that he cannot fulfill that demand of oxygen. And that's why the complications of this is really bad, and this is something serious which has to be taken care of. And that is one of the reason why overweight and obese people in intensive care unit are more likely to get need of assistance with breathing, and there also the kidney functions get hampered because of, again, hypoxia, that is low oxygen in this scenario.
Doctor, you have spoken very well about the hypertension, diabetes, and obesity. I just want to ask you, what is the mental condition of the obese patients who are already isolated due to stigmatization of general public in the COVID situation?
Yeah, thank you so much, madam. Actually, I could elaborate more on this topics here, but due to time restraint, I have to stick to a lot of things, and I cannot go in detail to explain how and why it is. But if someone understand this, it would be really interesting, and they will really take good care of themselves to overcome all these issues. Yeah, but mental health, I guess, a very important thing. Yeah, because there are a lot of things people are facing. Like, if I have to just go on a very basic note, which Dr. Saurabh has told about the WHO certification, what he did, I did a similar thing where I came across WHO's article itself, which said that fear, worry, stress are normal responses which are perceived by any of the individual when they don't know about certain things and unknown conditions. So fear, worry, and stress is very common. Even if we go as teachers, what we are dealing, uh, even if a student comes and we are unknown of any question or answers, we are not aware of anything, so we already get fear of that, we get worried about that, and we get stressed. So this is very common phenomenon which is seen. And fear is again one of the major factor and very commonly goes parallel to this COVID-19 pandemic. Everyone here today, even we are sitting live, everyone must be of fear and worry and stress, what will happen, whether I'll be called, I have to work here. So this is very common here. And talking about this mental condition, about a obese person who is isolated during COVID-19 is again a major concern. If a normal thing, if I have to talk about obese or overweight person, normally they have a stigma of the social people when they go out. If they go out with the friend circle, they usually feel and compare themselves with their group, and they say, already I am fat and I have excess weight because of than you, then they already have the low self confidence is low in that normal situation also. So already the stigma is there in their mind that they are low confident, they are depressed, they have a lot of complaints with themselves, with their life, and their surrounding people also. Now in this COVID-19, if we talk about the mental health of these people, they are isolated even from these problems, like this good things when they were socializing, even though they were depressed and are talking to stigma of these issues when they were meeting their friend, they are already isolated from all these factors. So mental health is already depressed in these patients. We already come with a lot of obese and diabetic patients, obesity patients, diabetic patients who are already depressed, saying ki we cannot go out, we cannot do anything in this scenario. Neither we can go out. Sitting at one place, we are already gaining a lot of weight. Our sugars are not in control. So all these factors are commonly seen in these people. Yeah. So all the mental health itself is depressed in these patients. Here I would just suggest in 2 3 sentences is like people those who are already on these medications or already overweight and obese can ring up their friends, talk to them, and come out with that anxiety of getting depression, and can actually talk to Yogi Sakar, happiness coach, who is there, who can help them to come over these issues. And if you are facing this type of problems, it has to be actually taken seriously, so you don't go in major depression and where you have to start the medications from now only. And this type of people are majorly seen even in young obese uh, uh, generation as well. So this thing has to be been really give a heads up, and primary precautions and thinking should be done for these patients. Yeah.
So I think, Dr. Ketan, is that we have to change our lifestyle if we are in this fit into this group. I think Yogi Saka will be able to highlight and give his view on this. So, Yogi Saka, would you like to enlighten us with your perspective?
Thank you very much, Dr. Vaidya, and namaste and good evening to every panelist over there and to every audience who is joining us on this webinar. Yeah, so lifestyle. First of all, it's very important to understand that we live all our life in the mind. That it's in the mind we experience life. And therefore, when people say, I have to change my lifestyle, I have to change this, and I have to change that, very simply, it means that I have to change the style of my mind, in which my mind is thinking, perceiving, experiencing, and trying to kind of, make sense of the world, and trying to define what health is, what happiness is, what this kind of, life is all about. So here is where a holistic approach of well-being comes into picture, where people understand that life is lived in the mind, and most people have no idea about what this mind is all about. And when it comes to enhancing any experience of life, it is only when we enhance our mind we experience life in a better way, because that is the instrument. The mind is the instrument through which we experience life. So I just happen to remember a kind of a funny humor, a joke, that a woman goes to a doctor and she says that, doctor, I am not able to sleep. I got a very unique problem. Every time I sleep, I start snoring, and because of that, I wake up because of my own snoring. What do I do? So the doctor thinks about it. What is the doctor going to do? He says that just go and sleep in the next room. Our problem is like just like that. Most people are suffering because of their own mind. So whether it is a lifestyle choices related to food, the kind of food they put there in the mouth, whether the choice related to exercise, not to exercise, whether the choice related to be happy in the moment or in relationship, whether the choice related to what I need to do, all these choices are governed, by our mind, and we need to take the responsibility. And that is where I believe, as an holistic approach, it becomes significant that when we start with the body, we are also taking into consideration the mind and how the feelings and the beliefs of the mind are related to our food and our lifestyle.
So, Dr. Ketan, what is the impact of bad lifestyle on women's health? And can you comment on condition like PCOD? Because many of our students are suffering from PCOD. Is it because of bad lifestyle? Is it because, as he said, mental health? What exactly is it? I think my students would like to know more about PCOD and how can they overcome this?
Yeah, sure, madam. I know that PCOD is something which is very commonly seen in the women's and the people who are here in any areas. Yeah. But before going to that question, what question you just asked, Dr. Yogi Saka, I would just put one sentence over there. It's like what he has told is absolutely right. Yeah. We can just remember one thing: Corona or COVID-19 will pass on, but our lives has to go on. So this is the scenario which
True.
we have to remember here. Coming back to PCOD, yeah, like a lot of people, a lot of women face this problem. It is polycystic ovarian disease or syndrome, we call it as, and we get a lot of patients with this and having a lot of mood swings. They have irregularity in the menses, and even there are difficulties during their pregnancy, conceiving, and a lot of other things. So the major problem here of PCOD is also because of the overweight, and the obesity. What we usually seen, this all is connected to each other. Yeah, and when you get a PCOD, you can just evaluate the patient. Majority, 90% of the women would be overweight or obese in this scenario. And the treatment for PCOD itself is losing the weight. Yeah, there is no other things with, of course there are few drugs which are available which can control it for the regular menstruation, but the crux of it, or to treat that permanently, we have just one option, is to lose the weight. How to lose the weight is a thing again where we actually work on, and we require a lot of live sessions and one-to-one sections for all these patients. You get obesity, you get a problem of PCOD. If you're having PCOD, we see you are already obese. So this all is linked to each other. So if you lose the weight, definitely your PCOD would be in good control. Yeah, that's all I can say on this. And again, to work on this, yeah, your lifestyle modification is the most important part here. And what we are going to discuss how to overcome this is again with your proper what Yogi Saka already commented, what we eat. Yeah, so what we eat, what we exercise, what is our thinking, mindful thinking is something which can actually overcome all these problems. Physical activities to be involved in this, and with this only, not only now but even for the next post lockdown also and COVID, we need to adapt to that lifestyle so we do not face this comorbidities or metabolic part of it. Yeah.
I think
Yeah.
Dr. Ravindra Shivde is not yet in.
Yeah.
Yeah, I have come now.
Oh, wow. Doctor, good evening, and you're
Good
coming
evening. Good
right
evening.
time. I would like you to also comment on the condition of women.
Yeah. Hello. Hello, everybody.
Hello.
Good
Hello.
evening, doctor. Can you
Good
put your
evening.
video on? Yeah.
Hello. I have just finished my cesarean and I'm here now.
Welcome, doctor.
Yeah. Hello. Good evening, everybody.
Good evening. Good evening.
Yeah. Madam, you were asking me a question.
Yes. I was asking you, Dr. Ketan had spoken about PCOD, and I thought
Right.
you will be the right person to also elaborate on PCOD about women. Yeah.
Yes. PCOD basically it's a hormonal imbalance problem, and it is found in many college-going girls at present. And almost every third girl that we do a sonography upon, she gets a report of PCOD. Now we are also very much perplexed why this is happening when this disease was so rare about 2-3 decades ago, and now why every third girl is being labeled as PCOS. Uh, the primary reason is the lifestyle of these college going girls, lack of exercise, obesity, fast food, high intake of carbohydrates, and stress. These are the main causes in the increase of PCOS cases, almost like a pandemic, as Dr. Ketan remarked. So many of these girls are landing up with amenorrhea, irregular menstruation, uh, signs of hyperandrogenism, that is facial hair. They also land up with infertility after getting married. And the treatment is mainly of lifestyle changes. There are some drugs also, ovulation induction drugs, and all those we do give, androgen inhibitors. But once they decrease their weight, once they take up an exercise and diet program, they stop eating junk food and they start exercising, their PCOS automatically goes down and they start menstruating and conceiving. So that's about PCOS.
Thank you, doctor. Now, a question to Yogi Saka. Give us a small introduction about your happiness coaching and what suggestions can you give to our viewers to manage stress in the state of pandemic?
Yeah, of course. So, as I said, most people have no understanding or lack of knowledge when it comes to how this mind function, what this mind is, and trying to, and it is, as I said, it is only through the mind we experience life. So happiness coaching is based on the same premise as health coaching, wherein the more knowledge you get about your body and the food which you give to it, and then you can develop and you can have better health, better physical well-being. In happiness coaching, I coach people based on the evolutionary aspect of the brain, and how the brain has actually evolved to this current advanced state, and what's really the science behind it, and its functions of imagination, thinking, and other aspects. So I'll quickly share a slide which I have. So this is something when it comes to happiness coaching. Right now, people are talking about stress management, and it is where people are experiencing stress, and that's why they are not able to cope up with the stress because of the way in which the nature of stress which is happening. It may be related to the social aspect, the financial aspect, the career aspect, money aspect, or even related to the most important, the health aspect. But we need to understand, first of all, when we talk about minds, lifestyle or mind style, what I was talking, that our lifestyle, the one which you follow in India, called as Bharat, is a holistic lifestyle. So never forget that what we are taught in terms of knowledge is that in every pain there is a lesson. That's why we have got these beautiful letter words of Vedana. Vedana means pain, and in Vedana there is Ved. That means there is knowledge which needs to be understood, which needs to be learned. In Shiksha, which means punishment or Dand, punishment is given for something where you need to learn from an experience which you need not repeat. So we have to understand, if you are experiencing any kind of pain in this situation, it is not because of the COVID situation itself. It may be mostly because the way in which we are perceiving life, and we are trying to imagine things, and we are not able to control or have control over the projection of our mind. So that is very important to notice here, where I uh, am reminded of a story of Buddha. When Buddha talks about pain and suffering, he clearly mentions about this aspect of pain is something which is going to happen, but suffering is something which we create out of our imagination and thinking. So pain is like the first arrow if someone is shot with the first arrow, and the suffering is the second arrow which you can't see, which we continue to dig into, and we are not able to manage our own imagination and processes of our mind brain. So here, as far as happiness coaching is concerned, as I said, I talk about more on the level of evolutionary aspect of how the mind, the brain has evolved, and therefore this aspect is the learning aspect, where we need to be in a state of learning, a state of discipleship, a state where we are continuously trying to understand and explore life. And at holistic center, that's what we do. We approach life in a holistic way. So this first is the body aspect, which is connected to nature. This mind aspect, the brain, which you call up, where we have all the experiences and we experience relations. And there the spirit aspect, which is the being aspect. Beautifully, even the word human being, as I have told many times, that human means HUM is Hamas, MAN is man, and being is spirit. So if we start thinking, living, and perceiving life as a human being, we would naturally want to explore our health to the fullest, our mind, our brain to the fullest, and also who we are. Um, Here, as I said, I've been in this field for around 18, 20 years, and personally practicing this happiness and spiritual and yogic holistic wellness lifestyle for a long period of time. And over a period of time, I've been able to synthesize this knowledge of brain function and yogic science. I really like the mantra chanting in the beginning, which was being played. And that initially had the mantra from Isho Upanishad. Isho Upanishad and the mantra of Isho Upanishad, the beginning mantra, Om Purnamada Purnamidam Purnat Purnamudachyate Purnasya Purnamadaya Purnam Evaya Vashishyate. This is the beginning mantra, which means that we already are a whole being. And out of our wholeness, out of our being human, we need to function and see. So the next mantra was Om Isa Vasyam Idam Sarvam Yat Kinchit Jagatyam Jagat Tene Taktena Bhunjita Magrat Kasvid Dhanam. So I purposefully took this mantra in a presentation because when I saw the prayer was going to be included, I thought, why not talk about this mantra, which gives a beautiful understanding about happiness being the core of our culture, where it is mentioned that the entire universe is pervaded by Ishavasya, means the blissful being or blissful God or bliss or happiness itself. And when we start seeing happiness in each and every moment and start functioning from happiness, then we will not experience life in a miserable way. We will not have negative emotions, feelings of greed, jealousy, frustration, depression, and resentment. Even the common to a current neuroscience or the brain science tells us that our happiness is on different levels. So as you can see, I've tried to mention or portray over here our brain image. The red one is the smallest brain, which is present is present in reptiles. The this violet color is in the purple color is present in mammals, where there are emotions and feelings, and the big brain is in the human brain, where one can imagine, think, create, feel, and experience life in a unique and a different way. So what has happened is that over a period of millions of years, these two brain systems have become very dominant and powerful. And this brain system is all about emotion, sensation, physical, and aspect, where our happiness is only related to objects like food, clothing, shelter, or maybe related to work aspect of wanting to get money, wanting to get name and fame, a relationship aspect of you and me, us and they. Uh, However, the higher brain function is all about trying to understand life, trying to live according to the nature, trying to find who I am I. And this level of happiness was defined by our great seers and our great rishis in this very intelligent and unique way, that we have to grow from different level of happiness. So initial level of happiness is calm. Calm is really something which is based on the desires of physical objects. Then earth is the happiness which one gets by doing certain kind of work and getting some kind of money. Then higher happiness is dharma, where we start giving something out of a charity, out of being generosity. And then finally is the happiness of liberation, of spiritual freedom, when we find that who we truly are as a human being, as a spiritual being. So these are the levels of happiness which we actually go through life, and from childhood to adult. When we are talking about how I can be happy and how can I manage stress in this particular phase which has been we have been facing. So as pointed out, it is very much common sense, or we need to accept the fact that all things which we have are in a constant passing phase, whether it is health, relations, wealth, or kind of any aspect. So we always have a fear of loss, whether it is related to health, relations, wealth, and honor. And that is again related to these aspects of survival tendencies of primitive brain. But we can also start seeing and functioning from a different level, where there can be joy of giving, wherein we start taking care of things so that we are functioning from a mode of uh, abundance, where we are trying to give things, we're trying to give money, we're trying to give knowledge, and finally we are trying to give up our own ego. So we each individually has to think at this point of time at your home, what is that which you can give to your family members, what is that which you can give to society, what is that which you can give to your neighbors, what is that we can give to your work. The more we think of giving, the more we'll start thinking from our big brain, which is beyond survival. Based on this, I have my happiness coaching, which is called as Uparati. Uparati means up means above, and Rati means to indulge. So Uparati means to indulge in the transcendental or higher pleasures of life. So that is holistic happiness. Refine your pleasure to manifest your treasure. So we all have treasure of love, joy, certain gifts within us, and that is something we are here to manifest. This word manifest again has a beautiful meaning. Man means mind, and fest means actually to become expansive. So we have to be expansive with our mind and thinking, and this is the way in which I coach. One of the aspect of happiness is to go through certain kind of visuals, certain kind of understanding, certain kind of journaling. So let me ask you guys a question, and to each one in on the even in the audience, like how many of us actually have been trained in how to think, how to feel, how to experience life, how to imagine, what is that which we know about, compared to the kind of education which we got about physical aspect. Like we know what it means when the body is in health, what it means when the body is healthy. For example, the blood parameters, the sugar parameters, the heartbeat, the blood pressure, the muscle, the body fat ratio is of certain measurement, is within certain range, then we call someone physically healthy. What parameters do we have, or have we decided that this is something which I call a happy mind, or a happy life, or a happy relation? Is there certain standard which we have been taught in school, colleges, or in any institution? I don't think so. That is been focused on in a detailed way, or in even scientific way. That is something which we need to understand. What we cannot measure, we cannot manage or understand. So I see here people struggling with their mind and experiences which have taken care over their life. It's because they are not able to manage or understand their mind and emotion, and that's because they have not defined what actually this experience of happiness is. What is exactly this mind all about, and how it functions. And at holistic care, we follow a system called as prime change with our people who come for our services. Prime change means the positive resolution of identity, meaning, and experience. That is prime. Change is conscious human ascension to nurture greatness and excellence. So this is something which I go in detail in my training and coaching session with people. But most importantly, what I go through is I work on their identity, meaning, and experience aspect. So our brain, human brain, the big brain, has got these functions, that it is self-conscious. It knows, right? I am this one. This is the body. This is the food, and this is something which needs to be done because this is for myself. This is for me. So the I function of the brain is something which we work on, which is the identity. Then we keep giving meaning and kind of notions and interpretation to the experiences which keep happening to us in life. So this is where the meaning aspect comes, which is unique again to the mind. Then the experience happen based on what we think about ourselves and what meaning we give. Most people directly run for the experience without trying to fix their identity and meaning, which is mostly incomplete, wherein they have negative self-image and negative self-belief, and they have given negative meaning to their life and relations and their attitude which they are having. Further, yeah, so this is an upcoming event we are going to have. You got people can inquire about it with Holistic Care Center staff. This is the Prime Change Meditation with Yogi. It will start from day June 1st. It's a 5 days of meditation series based on meditation of acceptance, meditation on abundance, meditation of happiness, meditation on relationships, and meditation on immunity or health or body. So this is something which we are trying to, from our side, educate people and bring this new way of seeing at health, happiness, and themselves. So this is a small initiative which we are going to start from 1st June. You can always inquire about this. And I would say why this is important, because when we don't live a life which is connected with uh, our purpose, who we are, when we don't live life which is connected with the nature, when we don't live life connected with our passion, then that our situation is just like a lion, a tiger, an animal which is kept in zoo and which is not in its natural environment, and we suffer on the level of body, on the level of mind, and on the level of spirit. But once we get the right kind of knowledge, once we connect with nature through right food, right physical activity, and then when we find and discover the purpose of what it means to be human, we are back again in the nature, we are back again in the family, we are back again in the society with that kind of confidence and pride. So the disease is actually of disconnection. So at Holistic Care, our mantra is connect to care and care to connect. And it is only through this connection we can have that holistic health and happiness. And we educate people on how to connect in a better way through your body, mind, and spirit. So that's something which I would talk about my way of holistic coaching and holistic approach towards mind and happiness.
Thank you, Yogi Saka. I think the Holistic Center and Gandhi Shikshan Bhavan philosophy of mind, body, spirit coincides, and that's why we train our students for the cognitive, affective, and the psychomotor domain. So Gandhian philosophy also talks about the holistic part, where because Gandhiji speaks about by education is drawing out the best of mind, body, and spirit. So, Yogi Saka, if we want to build you immune system in the students or in an individual, could you suggest some ways to build the immune system?
Yeah, of course. I like to again quickly share my slide, and I like to also mention that we talk about immune system, but immune system is unlike other system where we cannot see. It is not structural in nature, it is functional in nature. For example, when I say your skeletal system, people can see the bones and the joints. When people see the cardiovascular system, they can see the heart and the lungs. The nervous system, they can see the brain and the spine. But when you say immune system, there is nothing which you can see. There is only functional aspect of it which is operating, which has been taken care by specialized cells like T4 or macrophages and other kind of cell, which get activated only when there is a kind of assault, injury, or stress on the body. And that is where this particular slide which I'm trying to show, I'm showing where if there is an assault in the body, the immune function or the immune system gets activated to take uh, take care of this injury, so that the injury doesn't get worse. And that's why when the injury is being taken care of, the immune response is then subdued. It need not remain at a high level. What has happened is that when you talk about I want to control, I want to make my immune function better, it means that our immune function, first of all, we need to understand that uh, stress, chronic stress, directly affects our immune function in a negative way, because whenever there is high stress, the stress hormones of adrenaline, cortisol, and other stress hormones, they dampen our stress response. And that's why healing doesn't happen properly whenever the body is under stress. So we need to first of all take care of different ways in which we can manage or control or lower down this stress. As I said, stress either can be physical, that's something getting inside your physical body, or it can be mental, a evil kind of a negative kind of a foolish thought which we keep entertaining in our mind, which is again alien to the mind. So that is something which can create stress on an emotional level. and there can be stress on the level of food which we eat, which is not proper, with laden with chemical, laden with preservatives and refined flour and sugars. So these three stresses give the same kind of response of stress response, where the body takes physical, mental, or chemical stress in the same way. So we need to lower the stress. And what has happened over a period of millions of years, that our physical activity has gone down, our community living, where we used to live together as a community, our sunshine exposure has gone down. We have become sedentary. There is a lot of processing in terms of the food which has happened, packaged food which has happened. We are not moving around, we are shopping from our home. So this aspect, most important when it comes to reducing stress on the body and mind, needs to be addressed. And this way we can improve our immune function to a great way. Why? Because cutting down on these things, the secret to live well is think well, eat well, sleep well, move well, breathe well, behave well. So, well, it's all about bringing all this aspect of wellness. So what you can include in your diet and nutrition, include something which is close to nature, which is wholesome, and just dump all the preservatives ridden food, which have refined carbs and refined flour and sugar. Most important, very important, especially for Indians, because we love cooking in oil and frying and using oil. So very important that we need to replace our chemical refined oil either by cold press oils or by physical refined oil, which have got minimum amount of chemical, minimum kind of artificial ingredients added to it. And the next important thing, as an holistic aspect, is our ability to breathe, because through breathing we can manage our stress response. Every time we experience an emotion of any kind, that particular emotion, whether it is of a happy emotion, we'll have a different breathing pattern. Whether it is of depression experience, we'll have a different breathing pattern. Whether it is of a relaxed experience, we'll have a different breathing pattern. So when we take control of our breath and we bring it to a relaxed rhythm, the balance happens on the nervous system, where our both parasympathetic and sympathetic nervous system, which modulate our stress response, they get harmonized. And most important, again, the practice of alternate breathing, practice of deep breathing, which we teach in a very detailed and scientific way at Holistic Care Center. That those are again very powerful to subdue the stress response and to boost your immune function in a much powerful way. Because when we take in more oxygen and when we breathe out more carbon dioxide, naturally the body feels rejuvenated and there is less stress on the body. So that is something which we teach through our holistic health coaching. We call it swasthi. Swasthi means embody wellness. So here illness starts with I and wellness starts with we. That's what we believe in. When we focus too much on the I and when we focus only on the body, illness is going to happen. And we don't deal, as Dr. Saurabh said, people with only the conventional approach, where we see people as bones and joints, but we see people as a multi-dimensional being. And our coaching program has got 5 aspects of mindset training, detox, nutrition, exercise, and medication and supplementation if required based on the needs. So this is something which I would say when it comes to boosting or taking care of your health, these aspects need to be taken into consideration. And the best way is to, yes, first of all, reduce all the unwanted elements and then bring back all the good elements into your food, nutrition, and lifestyle.
Yogi Saka, I think we'll take your advice and we'll try to bring, but all said and done, we still are under stress. And I think Dr. Ravindra Shivde is the right person to tell us something about the information about COVID-19 at this moment. Dr. Shivde, you are on call today, right when we were here. Could you tell us about something about COVID-19, your experiences with pregnant women coming to the hospital during this time? Dr. Shivde? Dr. Shivde, are you there?
There must be some problem.
Yeah. So, Dr. Saurabh, in the meantime, can you give a highlight about how the situation is in your holistic center, about the current scenario till the time Dr. Ravindra comes in?
Yes, madam. Just let me put my slides on.
I think at this moment, whenever we go out as lay people, we are always under stress because of the COVID-19, whether we are going to have it or not. So it's very stressful.
So I hope you are all able to see my slides.
Yeah.
That is my short description and my disclosures. These are the certified courses I've done because as an orthopedic surgeon, I do procedures which are hip and knee replacement, and we are not doing them right now because they're elective surgeries. So I was kind of jobless. So that's why I took this initiative to learn more about this pandemic and to help people out. So whatever I'm going to speak, my sources are the ICMR, the WHO, and the Center of Disease Control and Prevention. These are the sources where I've got my information from. So if you see the current situation, I'll talk to you. I think Dr. Francis also shared a list what she received from the BMC, and majority of our viewers are school teachers and teacher educators. So this is the scare right now that BMC teachers have been called on COVID duty. Some institutes, educational institutes, have been turned into quarantine centers. And also BMC teachers from other parts who are outside Mumbai have given an indication to come back to Mumbai. So there's a scare between this whole group of people on going back to work with the COVID patients. So I'll shortly tell you all what this COVID situation is. If you see, this was an outbreak of the virus, which started in Wuhan, China, in December 2019. That's why it's called the COVID-19. It's named as the novel new coronavirus. And scientifically, if you see, it is called SARS-CoV-2, because it comes from the same family as the SARS. So, if you want to understand what a virus is, and I think this might scare you a little less. So, what a virus does is, a virus can only survive in a specific environment and in a specific place. So, it needs a very favorable environment to survive. So, for this specific virus, this has an affinity to the human tracheal epithelium, which is in your throat. So that's why whenever it is outside the human body, it is very fragile. So you can see it is very, all of the indications are wash your hands, use sterile things, use alcohol-based solutions. As in whenever it's outside the human, it is very fragile. So we have very simple ways of tackling with it until and unless it doesn't get in. So after getting to know all of this, you would like to know, in short, what is the mode of transmission. So the mode of transmission is mainly respiratory. So in the image at your left, you can see when a person is coughing or sneezing, there is a variable chance that up till 2 meters, he can spread the spit or this any droplets from the respiratory system, and it can spread to another person. This can also land on a surface, and on different kinds of surfaces, this virus has different kind of capacity to be alive. So if it's a metal or a plastic surface, it is about 24 hours. If it's a cardboard surface, it's somewhere around 6 to 8 hours. So if you see this virus, once it comes out of this human organism, it is very fragile. So there is also one route which is called feco-oral. Feco-oral is basically if spread through human feces, but this is debatable. One more source is fomites. What is a fomite? So suppose you're all getting deliveries at home, like the milk packet delivery or a pizza delivery, or a lot of people are delivering stuff now, newspapers. So this is a fomite. So if suppose all of this, when this was made, when this was processed, when this was packaged and delivered to your house, maybe there was some fomite, some kind of virus, which is on the surface of these things. So whenever you're taking a delivery, make sure you're sanitizing all of those things. So you are cutting down one of the mode of transmission. So I think it's been on the media, the news channels, and more than doctors, the media have been propagating about the symptoms. So if you see three kinds of symptoms, mild, moderate, and severe, most of the times, now here, this article which I read, it showed about 8% of people are asymptomatic. I have also come across studies from the US which say there are 38% of the people who are asymptomatic. So the numbers vary from each country, each region. Asymptomatic people are a lot. Even in my hospital where I see, there are a lot of people who have very mild symptoms. Mild symptoms can be fever, cough, dyspnea is difficulty in breathing, and some people are also noticing some kind of stomach discomfort. And severe symptoms can go to symptoms like pneumonia, respiratory distress. You go into septic shock, and these kind of patients. So even now, I do not want to comment on the percentage of these patients, but it is very low, and it is usually found, as Dr. Ketan said, in people who have a lot of comorbidities. Comorbidities as in other medical conditions, obesity, hypertension, age, diabetes, etc. So I am hoping that this is somewhere around 2 to 3%, which might need ICU care and all of that. So protective equipments. So here I am focusing on a group of teachers who are who I am addressing this to, because I want them to understand. 1.5 months back, we were in a same condition when we had very less information about what this virus is, how this is going to transmit, and what are the protective equipments we're supposed to be wearing and to protect ourselves. Right now,
Something came on my leg.
right now, we are not that scared because we have knowledge on how this thing transmits and how we can protect ourselves. So 1 month back, it was really scary. Right now, it's become like a protocol, and we're used to all of that. So to understand it in a very cheap way, two things. If you are posted in a quarantine zone, and if you're posted in an open air zone where you're supposed to see and form a statistic of patient, that this is an area, this house is affected, this area is affected, you do not need a personal protective equipment gear. This is the gear which will be sufficient if you're doing a duty in the open air, because in the open air the virus has very less chances of spreading, because the viral load, if you are in a closed environment, if there are 4 to 5 people in a ward or in a quarantine zone, the viral load of that space and the ventilation is less. So that's why there's a lot of virus so that the layman can understand there's a lots of virus in the air, and probability of you getting infected in a closed area is very high. But if you're doing a duty in an open ground, or you're just doing a statistic of which area is positive and which area should be a containment zone, then mostly you're very safe. If you follow these three things, the one thing at the rightmost thing is a face shield. The face shield will always protect you from three things. From where can the virus enter your body? It is your eyes, your nose, and your mouth. Only these things, if you cover, there is no way the virus is going to enter your body. So that's why the face shield. With the face shield, if you are posted on duty where there is all of these danger zones, like red zones, what the ICMR and the WHO guidelines say, if you're caring for a patient, you use an N95 mask. But now I think the N95 masks are there in stock, so there is no harm of using it. Earlier, they were suggesting N95 masks only for healthcare workers, and they were suggesting only using a 3-ply mask. I will later come on to the importance of how and why to wear a mask and how to remove the mask and how to dispose it. The gloves. So people are wearing gloves and they're touching their faces. So to understand what is a glove, there are two functions of a glove. One is because you're sanitizing your hand all of the time with alcohol-based solutions, you are protecting your hands from this alcohol-based solution. That is one function of the hand. Second, in this kind of a pandemic, when you are wearing a glove, the function of the glove is to remind yourself not to touch your face. The virus is not going to penetrate into your hand. You're not protecting your hands with your gloves. You're protecting your hands from the alcohol-based solution, and it is a reminder that do not touch your face. Coming down to PPEs. Now, for people, I do not know, and I really do expect that they would not put teachers in charge of zones which are quarantined, or there are now schools or hotels where there are positive patients kept and they're quarantined. These patients are usually asymptomatic, or asymptomatic as in the people who do not have any symptoms, cough, cold, or anything, or these people are mild symptoms. So I really do expect that teachers would not be posted inside these organizations, but if they are posted inside these organizations, there should be a proper training on how to wear a PPE. Just wearing a PPE of protective gear is not adequate. How to wear it, how to remove it, it's really important. A really good trained person who uses just a mask, a face shield, and gloves in a proper way is well protected compared to a person who does not know how to use a 1 lakh rupee spacesuit, which the NASA scientists wear, and I don't know. So there are various videos. It is the responsibility of the authorities to train you. There are various videos on YouTube. There are various videos on the WHO official site which can train you how to wear and take off the PPE and how to dispose it. So before you enter and before you start to duty, I think you should definitely check this out. But if you are posted on an open area, this is not required. These resources for our country are limited, and I think wasting it to giving it to people who are posted on streets and all of that is not required. So very importantly, I have come across a lot of people who are wearing gloves or touching their faces, touching everywhere, touching their faces. So I would like, this has been performed over the media a lot of times, but I want to emphasize on what you need to do when you're wearing a mask. So first, whenever you are touching the mask, you have to perform hand sanitation, sanitize your hands with, there is a particular method of sanitizing your hands, which we will demonstrate in a video later on. After you have sanitized your hands, you always need to touch the ends of the mask and do not touch the outside or the inside of the mask. Whenever you are wearing a mask, you touch the back of it and just try to pinch this down so that the people who wear spectacles, there's no fogging. Whenever the mask is on, there are a lot of people who are trying to touch this mask and go down, and they are finding some difficulty while talking. I think it's worth facing this difficulty rather than getting infected. Bear with it. There will be some difficulty while you're talking, but I think we should bear with it. This area of the mask, the front of the mask, should not be touched in any cases. Accidentally, if you touch this area, then you should perform hand hygiene. Because if you're talking to a person, it can also spread through saliva when the person is talking to you loudly, or if someone has sneezed. So all of this is going to accumulate on this area. So this area of the mask, the outer side, is really infected. So, and while removing the mask, you always go back, you remove it from the back, and you dispose it in a closed bin. So now I will talk about various equipments that have come out in the market. One is what do you sanitize your hands with? One is recommended thing. If you're just using soap and water, then the hand sanitation should be applied for about 60 seconds. So you should wash your hands with soap for 60 seconds. If you're using alcohol-based hand rub, then the recommendation is above 70%. This is a company which we're using because they are usually making products which are safe for your hands. If you have any kind of allergies, if you have any kind of reaction to the alcohol-based solutions, always use glove, because this is gonna last for long. There are various solutions offered in the shops now, which are based on sodium hypochlorite, which is really cheap. Then there are quaternary ammonia chloride solutions. There is citric acid solution, hydrogen peroxide solutions, which act very well on cleaning surfaces. So if you're in an indoor environment, you make sure that these surfaces, whenever there is a patient, whenever there is loud talking, whenever there is cough, whenever there is any kind of fluids coming out of your nose or mouth, all of these surfaces should be cleaned multiple times. So the details of this, what surface should be cleaned by what kind of solution, is not in this lecture. So you can get in contact with us and we can explain you the details about it. Leaves and quarantine. I believe that a person who's posted for such kind of a duty, he should get adequate leave. The WHO suggests, and there are all variations among the government, the state government, and the central government. What the WHO suggests is a person who's on a quarantine duty for 14 days, he should be quarantined after that for 7 days. And he should have enough time to rest and to see whether he has gotten symptoms. Duty hours of this person should be 8, because whenever you're outside, it is not very safe to take out your mask, have food. If you're placed in a quarantine zone, you cannot have food in a quarantine zone. You cannot drink water in a quarantine zone when you're looking at patients. So all of these times should be limited. And this is one reason why, after using all of the resources, the government is, I think, appealed to all of the educators to help them out, because we are also short on hands and we need people who are right now serving the nation. We need them to rest a little bit and them to get quarantined and them to recover and get back to their duties. What I want to give a simple example before I end this session. So I come from a Marathi background. So there is something called as sohra. A lady in a kitchen, she will always follow sohra, which is if you touch a vessel which is cooked by non-vegetarian food. So she will not use the non-vegetarian food hands, and she'll not directly touch it to a vegetarian meal vessel or any vegetarian meal. So this sohra is what you need to keep in your mind before you touch your face. If you have touched anything, remember, you do not want to touch your face before you create hand hygiene. Second is, whenever you finish your duty, so it is a very sad thing, and this example is followed by all of the Marathi households. I don't know in other cultures. So if you're going to a funeral, when you come back home, you're not supposed to touch anything, and you directly go to the bathroom. You put your clothes, whichever you have worn there, you put your clothes in a bucket, you sanitize them with solution, soap solution and all of that, and you touch nothing in the house. You directly go to the bathroom, have a bath, and only after that you come out. So that is what we need to follow. So these are two examples which you can learn from the old Indian traditions what we have.
Yeah.
Thank you
Thank
very
you.
much.
Thank you, Dr. Saurabh. You have given us really valid suggestions, and I hope teachers are ready to go for their duties, although there is fear. However, now you have given us all the preventive measures. We want to hear it out from Dr. Ravinder Shivde, that what is the current information about COVID-19? What measures are required to be followed to be safe? Dr. Ravindra, could you highlight on that, please?
Yes, hello ma'am. Hello everybody. Sorry for joining late. I was held up with an emergency, but I'm here. I shall begin with a small presentation. Many of the things mentioned in this presentation are already known to you. It will be a quick revision for all of us. So I'll just start with the presentation, and then I'll take up certain questions which have been already circulated on our WhatsApp group. So this presentation basically gives an account of what coronavirus is and what are the common measures. Can you see the presentation now? Hello?
No, doctor. No, doctor.
Am I sharing my screen with you now?
No, doctor.
Not seeing the screen. Okay, I'll just try once more. Just a minute. I have clicked on the share screen button. Why it is not coming up? Share.
Yes.
Yeah,
Suppose
yeah.
It's
Yeah.
coming, doctor.
Yeah, it's coming.
now it has come. So starting with the presentation, you can see the presentation. Presentation visible?
Yes.
Hello?
Yes, doctor.
Yes.
Yes.
Yes. Okay. So we shall proceed with that now. So as all of us know, basically coronavirus is a respiratory disease, and the virus enters through the portals of the nose and the mouth and even the eyes, and then it leads to a kind of pneumonia. The virus which is causing this belongs to a very large group of viruses which are originally known as coronaviruses, and to distinguish this particular virus from the old coronaviruses, various terminologies are used, and now it is labeled as COVID-19 because it was discovered in December 2019, and so it is called as coronavirus 19. So this virus was identified first in Wuhan, China, as all of us know, and it is doubtful how the whole epidemic started. It probably started in animals, but now it is spreading among human beings also. Basically, this virus is so new that the scientists are also very much ignorant about this virus, and we really don't know how this virus becomes so infective, how this virus has become so potent, and what are the measures that should be taken by the medical community. We are all in the process of learning because this epidemic has been thrust upon us like a bolt from the blue, and so the medical community itself is not really very confident of teaching. We are learning by trial and error. Now, as all of you know, the travelers who were infected from various cities in China, basically they spread throughout the length and breadth of the earth, and they have now traveled to all the countries of the world, the Western world, and also the Asian countries, and through them, many other of their contacts have also been infected, and so now this has become a global pandemic. But we can still prevent this disease as a very alarming proportion by following certain simple measures. For that, we have to get a very clear idea of how the pandemic is spread. We all of us know that there are certain respiratory illnesses like cold and flu, and we know that these illnesses are spread through droplets. droplets are very small particles of our respiratory secretion, which are liberated in the atmosphere when we talk or when we cough or when we sneeze. And when other people come in contact with these droplets, the droplets go into their respiratory tract, and then the virus enters the lungs, lung tissue, the pulmonary tissue, and that is how it infects the body. Another mode of infecting yourself is touching an object which is contaminated with this virus. In medical terminology, we call these objects as fomites. So these fomites are the objects which people handle very frequently, like door handles, staircases, or objects which are of common use like furniture, sitting arrangements, etc. So these objects basically get infected through human hands. When other people come in contact with these objects, the virus lands on their hands, and then when the victim touches his or her face, the virus enters through the nose or the mouth. So if you follow this basic precaution that the face should not be touched with your hands, which might be contaminated, most of the spread of this virus can be limited. Another important thing about coronavirus is that an infected person does not always appear as a sick patient. The symptoms of this disease may be minimal, or there may be no symptoms at all, and that is what makes it more difficult to identify a person who is infected with coronavirus. So this person basically functions like what we call in medical terminology as a courier of the virus or a carrier of the virus, spreading this around without himself or herself being aware that he is infected. And such people are more dangerous because they are freely roaming around in the society. And many of the symptoms of coronavirus are like any other common respiratory illness like flu. So it is very hard to distinguish this coronavirus from other common illnesses like common cold or flu. There may be a little fever, cough, sore throat, fatigue, but these are very non-specific symptoms. Shortness of breath is a rather serious symptoms which will lead a person to go to a doctor. Another important symptom is sudden loss of smell and taste. There may be a bit of headache or body ache, and in rare cases there may be diarrhea. Another funny thing about virus is that the incubation period of this virus is very long. The symptoms may start immediately after the virus enters your body, that is within a day or two, or it may take as long as 14 days. And for these many days, this particular person will be roaming around in the society and carrying the virus and infecting others. So that is one of the bad parts of this particular epidemic. Now, very few people develop a serious illness which leads to admission to intensive care management units. Most of the patients will develop mild symptoms and they will get okay within a few days. But these people who are having comorbidities like diabetes or heart disease or blood pressure, and who are of advanced age, they may land up with serious complications, and some of them may even succumb. Now, regarding diagnosis of this coronavirus, it is very difficult to diagnose clinically because, as I said, most of the symptoms mimic common respiratory illnesses like common cold or flu. So a laboratory diagnosis is necessary by taking a throat swab or a blood test. Now, in various places, these tests have become available, but because of shortage of materials, the government is not encouraging testing on asymptomatic patients. Otherwise, it will lead to exhaustion of the consumables, and victims who are really in need of testing will not be able to undergo testing. So only when a doctor strongly suspects that the patient is infected with coronavirus, he or she sends the patient for this testing, either a throat swab or a blood test. Regarding the precautions which we have to take, they are common sense precautions which have been elaborated even beforehand by Dr. Saurabh. washing our hands frequently with soap and water. Now, how does soap work basically? Soap is basically a chemical which dissolves fat. Now, where does fat come in this coronavirus? Coronavirus is basically a protein particle which is having a layer of fat on the outside. And what soap does is to break this outer layer of the fat, and that is how it inactivates the virus. That is the importance of soap and water. The virus is not a living particle, so we cannot kill the virus. Bacterium is a living particle, but virus is not living. What we can do is inactivate the virus by breaking the lipid or the fat covering of the virus. In absence of this fat covering, the virus cannot enter the body and cannot replicate. So washing with soap and water is sufficient. We need not use antibacterial or antiseptic solutions per se, because most of them are effective against bacteria and they are not going to destroy the virus. So ordinary soap and water or alcohol-based sanitizers are good enough for eliminating most of the viruses. We'll be shortly showing you a video about proper technique of washing the hands. Secondly, you have to prevent infecting other people from your own secretions. And the best way to do this is to wear a mask. Mask will be having a double function. It will be preventing the spread of infection from yourself to the society and also protect you yourself from getting infected by other members of the society. If you do not have a mask and if you feel like coughing, you can cough inside your elbow like this, rather than spreading your droplets into the atmosphere. Another important instruction is not to share food, drinks, or any personal items which have been handled by other people, so that you do not inadvertently get an infection. The government agencies and the health officials have been instructing us to follow social distancing. Now, what is the rationale behind social distancing? Basically, the droplets which are released when a person talks or sneezes or coughs are airborne. Now, these airborne particles do not get suspended in the air for an indefinite period. Ultimately, they sink down to the ground, and the trajectory over which they get projected in the atmosphere is actually not a very big trajectory. It is a trajectory of hardly 3 to 6 feet. By the end of 3rd feet or 6 feet, the particle sinks to ground. So if you keep your distance from the opposite person, if you keep a distance of 1 to 2 meters, the particles will not reach you. And that is the idea behind social distancing. The second important instruction, as I said before, is avoid touching the face. And mask, whether or not it prevents you in other ways, it definitely prevents you from touching your face with the help of your hands. So that is how mask becomes more important. And of course, any other socializing like shaking hands, kissing, hugging, or personal contact with the opposite person has to be avoided. So any activity which involves a large group of people, like social gathering, religious events, or going to a cinema hall or mall or gym, all these are now prevented. They are banned whenever there is a lockdown. All kind of non-essential travel also is banned, because traveling itself will implicate you in social contact and encourage the spread of the virus. People who can work from home are encouraged to work from home. So this is how you avoid exposing yourself to the virus and avoid exposing other people to your own secretions. Along with that, the hospitals or the areas which are frequented by patients should be sanitized very frequently with a solution of sodium hypochlorite, 1%, which is our ordinary chlorine. Chlorine is a very effective sanitizer, and all the areas where patients or relatives visiting the patients are coming into contact, like passageways, waiting halls, or consulting rooms, are sanitized with a spray of sodium hypochlorite twice per day. Now it is clear to us that we will have to live with this coronavirus for some time, at least for a period of 6 months, maybe to the end of the year. And so we have to prepare ourselves. We have to develop a frame of mind which is consistent with accepting the coexistence of this virus and forming a sort of friendly relation. We do not want to come in very close contact with this virus also, but at the same time, we cannot avoid being in company of this virus. So we have to learn to live with this virus, in other words. Basically, we have to prevent people who are vulnerable to the virus from getting the virus. Who are these vulnerable people? Basically, people who are of advanced age, or the age of 60 or 65, or who are having other illnesses like heart disease, hypertension, diabetes. If they develop the coronavirus, they are very likely to develop complications, go on ventilators, and their mortality, their death rate will be very high. If you develop any symptoms like fever, cough, shortness of breath, it is better to seek medical attention at an early age. Because if you do not do that, you may worsen, and ultimately when you reach the hospital, it may be too late. Travel to affected area should also be happening. When to use the mask? When you are staying at home, it is not really necessary to use a mask, but when you go out, as soon as you step out, the mask is essential. Regarding coping up with stress, Yogi has already given us a very lucid explanation of how we can cope up with the stress. Regarding the children and the women, basically the virus does not have much of significance during pregnancy, because basically it is like any other medical illness affecting a pregnant patient. Pregnancy is basically a state where the immunity of a pregnant woman is lower, because body basically is harboring fetus, which is a foreign body. And to avoid rejection of the fetus, naturally the immune process of the body is suppressed during pregnancy, and so the patient becomes vulnerable to all the illnesses. That is why pregnant patients have to be extra careful to avoid getting infected. Does this virus go from the mother to the fetus? Yes, it can go through the placenta, and the newborn baby can also get infected. But fortunately, these babies do not develop any serious complications. We are also in the process of learning, as this virus is very new, but few pregnant patients have developed coronavirus disease and they have delivered also. But fortunately, the babies are not badly affected, and along with the mother, they also recover very well. The patient may deliver prematurely when she gets infected with the coronavirus. Does this cause abortion? The abortion rate is not very high in patients who are infected with coronavirus. So that is, in short, some of the information which I would like to share with you. Thank you very much.
Thank you, Dr. Shivde. I would like Dr. Saurabh to put the video of the COVID warrior.
There is a video of
Yes.
COVID warrior Dr. Anuja from KM Hospital. Would you like me to play that?
Yes, yes, doctor, please.
Yes. One second.
We have, in the meantime, we have questions coming up, which we will follow from this. We can't hear. Can you switch on your microphone? Dr. Shivde.
Quarantine centers, even isolation centers. And in all this, we have been accompanied by a lot of medicals as well as non-medicals doctors, we have a lot of community healthcare workers, volunteers coming up. And a common factor, common theme in all this that I've seen is there's a lot of fear surrounding COVID. So there's a fear of getting infected. There is a fear of transmitting the infection. So what I'd like to say is that what if we follow all the right precautions, if we make sure that we follow the rules that have been set, we take care when we are working as well as when we go home after we work, then we can eliminate this fear and we can work at giving ourselves safety as well as our loved ones safety. So the most foolproof method for doing that is by washing your hands. So the ideal way to wash hands is using these 6 steps, which I'm going to demonstrate for you now. So soap and water is actually better than washing with your sanitizer. Okay, but I'm going to demonstrate with this. So first of all, pour that on your palm. Okay, spread it around a little so that it doesn't dry off the plastic. Okay, so now first step is rub your palms together like this. Okay, second step, the back of the hands. Okay, make sure you reach all the spaces. Now after this, you have to wash the tip of your fingers. Okay, then the knuckles. So this part, okay, wash your knuckles. After that, you wash the base of your thumb. Okay, so this part right here. And after that, wash your wrist. So this way, you will get a complete hand washing. After washing our hands, now the next step is to wear gloves and mask. While wearing it, if your glasses start fogging or if you can feel the air coming in from here, then you have to remove that mask and you have to wear it again because the seal is not proper. The number of times that you remove your mask, you take it down like this to talk, you move it here and down. So the chances that you will get that virus transmitted are more. So once you wear the mask, you don't take it off till you have to take it off. There is a set of precautions that you should take to ensure that you keep the people at home. Okay? So these precautions include that first of all, you should make sure that you sanitize your phone, your key, your wallet, and all the objects that you're carrying with you in the facility where you're working. Another important thing is when you're coming home, you should rush straight to the washroom and you should have a bath. Because having a bath is going to make sure that you don't carry whatever infections you're getting from the facility. Okay, so you have a bath and you put all the clothes that you put outside for a wash. You can either put it in warm water or you can put it in a Dettol solution or any other antiseptic solution that you have. Okay? So cleaning, basically, once you get home, it should become a habit. It should become a part of your schedule. So it should come as instinct. And once you perfect that, then there will be no harm at all to the people at home. And I'm sure that is one of the most difficult things about working in this pandemic. That fear that you might carry that infection. But that will definitely be eliminated if you take the precautions as we have been taking for the past few months.
Thank you so much. It was from the COVID warrior. We have certain questions coming up. I would like you to give me an answer to the participants' question. So my first question is by Dr. Rajiv Jha, who's asking, is handkerchief safe to be used as a mask? Will the ordinary green cloth surgical mask available at medical shops safe? Dr. Ravindra, can you
Your mic is mute.
mute?
Mute. Mic is mute.
Can you hear me now? Hello.
Yes.
Yes.
So there are various kinds of masks. Ordinary cloth mask does not give much of protection because basically cloth is having very large holes. If you have a look at ordinary cloth, you can make out that it is almost a porous material. So the size of the coronavirus is in microns basically. So the coronavirus is not really blocked by the cloth mask. Maybe multiple layers of the cloth mask will help to some extent. So it is better than nothing. What you have to actually wear is a surgical mask, which is made up of a synthetic material. So that would be a better mask, which is having 3 layers, which is called as a surgical mask. Better than that, there is a mask called N95, which prevents 95% of the particles from entering your respiratory tract. And there is another mask which is still superior called N99, which is a little more expensive and also a little bulky, difficult to wear, causes suffocation, and it has to fit properly. So that N99 is not really required by ordinary citizens. Only people who are working in very high risk environment may use N99 or N95. Ordinary person can wear a simple surgical mask, which will prevent almost 70% of the particles from reaching you. And also, in case you are infected, your respiratory droplets from going to other persons. So an ordinary surgical mask is good enough. The important thing is that it has to be worn properly, as has already been explained by earlier speakers. You should not touch the outside of the mask at any time. While wearing it and while removing it, you have to only touch the back portion of the mask and discard it immediately. Surgical masks are disposable masks. They are not really to be used again and again, and they are not so expensive also. N95 mask has to be sterilized after use, and it can be reused again for a few times. So that is about the masks.
Dr. Yogi Saka, there's a question on how can we release stress of our parents during pandemic situation?
Yeah. So first of all, I like to make this clarification. I am no doctor. So
Sorry.
I'm Yogi. So first of all, I would say that I really appreciate the person who has asked the question and concerning the parents. So the very first thing I would say, you yourself don't get stressed. And especially when you care so much about the parents, try to see that is there something which they really need in terms of their requirement, in terms of what is the care which may be missing because of certain situation of lockdown which has been prevailing. Is there something which needs to be taken care of on the level of their health, physical needs related to medicines or food, a certain kind of way in which that could be addressed. Um, Second thing is something which I would say is based on physical activity. If in case they have not been moving around, if they're not being if they've been for the past couple of months because of the lockdown, they're not able to take a walk out in the garden or somewhere, in the park where they used to continue with their daily routine. That plays a big role to create the stress on the mind as well. So I would encourage, for them to do certain kind of loosening yoga exercises or just kind of walks in between mornings, afternoons, evenings. So they can break it up like that 2-3 times in a day. And finally, again, as I was mentioning, the practice of deep breathing and practice of meditation will surely help them also during this time. So these would be certain things which I would suggest.
Thank you, Yogi Saka. This question goes to Dr. Saurabh. Doctor, when we go out for walk, Dr. Rukmani Jamdar is asking, when we go out for walk, should we cover our face? Does the virus spread to air?
So, as we mentioned earlier, so the spread of the virus is more variable if there is a person coughing, or if there's a person talking loudly, if there's any spread from the sneezing activity. It can cover about 2 meters, which is 6 to 8 feet, So if there is adequate social distancing, so there are also side effects of the mask. Now I've been wearing it for the past 2 months. There's a callus on my nose already, and I have also noticed I used to wear it during workouts. So it makes me a lot of breathless. There are events which have happened that people have fainted due to less oxygen. So during workouts, it's suggested to keep off the mask and just follow social distancing. If you're 2 feet away from a person, it's very less likely that you might get infected. Plus, there are very less chances that you might get affected in open air. So I usually drive my car when my windows are open because I like to feel the fresh air. So all of that is safe.
Hello.
Yes, Dr. Francis.
Yeah. There's another question coming up from Rakesh Mistry. He's asking, is there any treatment in which human blood plasma of someone can help? And how long generally it takes to form antibodies, which when encountered? He has not written whom he wants the question to be addressed to, but any of the doctors can help him out. Hello?
Yeah, I'll just put some light on this actually. So
Yes.
what the plasma therapy which is going on for the patients for curing this COVID patients, there are few successful stories which have been reported, but again we are lacking of the concrete data which can prove can this plasma is actually can cure a COVID-19 patient. There are a lot many trials going across the country, across the world, and everyone is giving their type of treatment, their type of trials. Even our hospitals where we are working and another hospital next to each other, like the hospitals near to each other are giving different type of trials. They are trying with somebody's trying with antiviral drugs which can be useful. Same is with the plasma therapy. The outcome was good enough, but again to prove that this is only the line of treatment, we require a concrete data to prove it. Yeah.
Okay. Doctor, there's a question coming up for Dr. Ravindra.
Yes, madam.
The question is there any relationship between PCOD and back pain, L4 and L5 bulge? This question is from Meena.
Basically, PCOD is a hormonal disease and back pain is probably due to orthopedic causes. So these two are not related. Maybe the person who is suffering from back pain is having some orthopedic problem, or maybe there is a muscular problem, and there might be calcium deficiency, osteoporosis, all those things. So, but it is definitely not related to PCOD. PCOD usually causes irregular menstruation, development of facial hair, and obesity, that is increase in weight, impaired blood glucose metabolism, infertility, and it basically leads to a lifestyle kind of a disease. And backache is a very complex problem. There are multiple causes of backache. Even stress can also cause backache, or poor posture, poor sitting habits. All this can cause backache, but PCOD is not one of them. PCOD is not actually related to backache in that.
I would like to add. So I don't see any direct relation between PCOD and backache, the specific which has been mentioned. I suggest you to see someone like Dr. Ravindra and me to get both of these issues sorted.
We can I can just add on here. We can ask the question, the person who has asked the question, to check whether, as we saw, it is a complex mechanism, PCOD and obesity, to check that person's waist circumference and see whether it is also overstretch and BMI is more, hip to waist ratio is more. So that can also be one of the reason for the backache. Yeah.
Yes, obesity can lead to backache, and PCOD can lead to obesity. So that correlate. I mean,
correlate
it's
that.
it's a far-fetched thing. Yeah.
Yeah. There's a question coming up by Sandeep Deshmukh. I think it's for Yogi Saka. My question is, emotional and mental stress different? Are they? Are they different? And is the mind in brain and emotion is in heart? Then how to sync and manage both mind and emotional health simultaneously?
Yeah, I mean, this is something which even one starts dwelling and trying to explore this mind stuff. It's very obvious these kind of questions come up. So I would just like to answer in a simple way that it's just for the sake of terminologies. We use the word like mental. So when we use the word mental, it will include everything of your emotions, feelings, beliefs. It's like an umbrella term which we are using. Your mental status related to the way you are thinking, the way in which you are perceiving, the beliefs which you are having, um, that definitely has an impact on your feelings and emotions. So that is something which I would say when we talk about mind health, it is about mental health, and mental health includes all these aspects of emotions, feelings as well. The second aspect was whether the I didn't get brain is in the mind is in the brain or what.
The question is mind in brain and emotion is in heart, and how to
Yeah.
sync and manage both mind and emotional health simultaneously?
So again, when you say mind, it is nothing but the brain in action. Because when
Yes.
you are brain in action, especially our thoughts and imagination in action, because when you are asleep, at that time there is the action only of the physiological part of the brain. The mental cognitive aspect of the brain is not active at that time, unless you are dreaming. So in that sense, mind is nothing but brain function which is in action, and especially the imaginative aspect of the brain, the big brain which we're talking of earlier, which we saw that is something which, if people are not able to understand, explore, and manage it in a better way, that can lead to a lot of mental agitations, and which can create a lot of stress. So yes, these parts of the brain, I try to stick to the brain. I try to stick to the brain, and I talk of mind all as brain in action. So it's just like you got muscles, but there is strength of the muscle which can be noticed only when this muscle is in action, or flexibility of the muscle, which can be also known when the flexibility the muscle is in action. So same way, mind is the function of the brain when it is in action.
I think this question goes out to Dr. Saurabh. Geeta Pujari is very concerned, and although you have already informed us, she says to please highlight about the count of hours the virus stays on plastics, vegetables, carb, cardboard, and on mobiles.
So I think if it's a surface like cardboard, it's 6 to 8 hours. From surfaces like steel and plastic, which are plain surfaces, wood, mobile, it's up till 48 hours. And this is very uh, variable data. Like various sources talk various amount of times. So it's not very sure. So it is very safe to assume 48 hours, which is the maximum amount of time to be very safe.
Okay, thank you. One last question, and this is really a question I wonder if any of the doctors will be able to answer. It's from Professor Leeladhar Gaikwad. Can you tell me how many days the corona will last?
Okay, this I guess it will last for some more time here, and as this is a pandemic, and no one can actually comment on this when it is going to end. We need to adapt to this situation and start living with it. Yeah, so there is no other way, though, if the lockdown is up or this is going to end. for some more time, we can see that up curve of that patients and the COVID wave come back. I guess we need to just adjust with ourselves to the surrounding and start living with it. Yeah.
Dr. Saurabh, would you like to say
I,
something?
yes. So I think Corona is here to stay. So are these new viruses like MERS, SARS, H1N1. Year back, I got H1N1 myself. I was infected. It was like not a recent virus which came in. So you always had Tamiflu. There was treatment. So I just hope that, and all of us should hope that whenever we just need to delay things, it's a respiratory infection. It's not so grave. It takes too much of complications with elderly and all, but on normal people who are healthy, there's not much complication. So we should just pray that we don't get infected. And if we get infected, it's so delayed that there's treatment for it.
Dr. Shivdev, would you like to say something about it?
It is really very hard to predict when this pandemic will end. It may not end as my colleagues have already highlighted. We may have to just live with it. It may become our friend, so to say, just like dengue or swine flu,
Or HIV.
measles, and there are numbers of viruses. In fact, do you know that the 10% mass of our body is made up of bacteria? We are living. We feel that we are 100% human, but actually we are only 10% human, and the rest of the mass is made of bacteria. There are bacteria all over our body, both outside as well as inside, in all the spaces of the body, in all the cavities of the body, and we are living with them. So ultimately the body will learn to live with this virus. There may be development of what is called as herd immunity also, when a large number of patients do get infected. Maybe it will become something like measles, as children get infected with measles in childhood and they develop a lifelong immunity. Maybe a vaccine will come. Vaccine will take about a couple of years. They may expedite the vaccine because of the urgency, and it may come earlier also. In that case, we'll get some protection, but not 100% protection, because none of the vaccines is having 100% protection. And like other vaccines which are effective against measles, mumps, German measles, polio, children may just start getting vaccinated against coronavirus in future. So ultimately, human race will learn to live with it.
I think that's what was the webinar of about coexisting with COVID-19. So
Right.
we need to exist and we need to coexist with COVID-19. And I think we had a very fruitful deliberation regarding COVID-19. So I thank all the panelists for giving their perspective and helping us to understand better COVID-19. Thank you so much. Last but not the least, I will request my principal, Dr. Ratnaprabha Rajmane, to give the formal vote of thanks.
Once again, good evening. Wonderful session, I will say. And we are sitting with the doctors. They have given so much time for us. That is
Yes.
what I'm extending my thanks to all these doctors panel. You are in emergency, you are in the practice. That is what we have chosen the Sunday. And this Sunday became a fruitful for us. First of all, I wanted to thank Dr. Saurabh that you are a technologist also, doctor also, and a holistic center in charge also. Means you're a dynamic person and integrated personality I'm seeing in you. Sir, uh, you have given a wonderful talk about how the holistic being should be there and what precaution we have to take about the pandemic and how to go ahead. I'm coming to Dr. Ketan Phalke. Sir, you have given a very good advice for us, basically for fat people. Fat people means we are all means we are not taking care of our health. And you said that metabolic syndrome, diabetes, hypertension, these are the very difficult things in this COVID situation. So beautiful means mental and the physical balance, how to keep it up, that you have given. I hope you would have to give some means some measures also to how to keep it, but we were not having that much time, but we will soon meet you. Dr. Yogi sir, the beautiful happy learning, happiness coaching you are doing, but I want your smile. Because happiness is also always known by the smile, and you become very serious. But I want you a smiling person here, and you have given that mindfulness and the well-being, the balance between the mindfulness and the well-being, and body, brain, and spirit. That major thing you have highlighted here, and how the immune system is depending on all these things. That wonderful information you have given here. Dr. Ravindra Shude, I'm admiring you because you did the cesarean. We don't know whether uh, a boy or girl, but but you did it, and you came on the panel. And means hats off to you, because it is, we are always under tension when the cesarean and all these operation surgery is going on. But really good balance you keep it, and you came over here, and you have given the wonderful talk to us. I extend my thanks to you also. Here, uh, small means she's not a small, but she has given a Anuja Shude. She has given a video, and actually I told her that you have to show some pictures also, but she was away from the internship. But she has given a wonderful information about how to while coming home, while going out, and how to protect us from the COVID-19. Once again I am extending this thanks from on behalf of Indian Council of Basic Education, our management, and Surishma College of Education, and very well. Last 1.5 years we are sitting here, and people are also listening seriously, asking the question. And I wanted to, I will not thank to the Francis, but I will say her that wonderfully you have moderated this session, and you have given a very good, means very good link you have joined with each other, and wonderful techno things we have got from the Manisha Taragar. She is not present here, but I thank her also. And I thank all the participants. Means last so many, last so much time they are asking the question, and they're sitting and seeing this webinar. It is very useful for them. Thanks a lot. Thank you very much, all doctors panel and all.
Thank you.
Thank you, Vayan.
Thank you, sir.
So we close the session. Thank you, everyone. Thank you, dear
Thank you,
participants.
everyone. Thank you so much.
Thank you. Goodbye.
Yeah.
Goodbye.
Thank you.